More than 24 million Americans live with cataracts, and that number is expected to double by 2050. June is Cataract Awareness Month, and although cataracts can be removed through surgery in most cases, they're still the leading cause of blindness in the world. So joining us now to talk about the risks of cataracts and the benefits of getting them removed is Dr. Ravi Patel from Florida Eye Specialist, also Mary Jane Brewer, who just underwent cataract surgery a couple months ago. How you doing with it, Mary Jane?
Well, I'm doing great. I can see you great. It's
okay,
wonderful.
3 months ago, would you have been able to very well?
Yeah, my vision wasn't that bad, but what I hadn't realized is from one appointment to have my regular eye exam to the next one, my vision had failed that much, and I didn't even realize it.
Really?
That's the problem with cataracts, I discovered, is you don't know that your vision is failing.
Really?
It seems like, well, everything's the way it's supposed to look. It's always looked this way, but it's such a gradual process that you're unaware of it. Until I finally realized, going to the eye doctor, she says, no, you've got cataracts. So within a year's period of time, I needed cataract surgery. It happened that fast.
Really? So, Dr. Patel, what are some things that people want to know, if they're in this position here and maybe don't realize it? What are the things you want to look out for?
Well, just like Ms. Brewer had stated, that's one of the most common causes is a gradual, painless decrease in your vision.
Okay.
Some of the initial symptoms that patients will often comment about is blurry vision, problems with nighttime driving such as halos and glares, a frequent change in the prescription,
yes,
and just not being able to see as well as they used to be able to see. Some of the risk factors is obviously aging. Over half of Americans over the age of 75 have cataracts.
Mm-hmm.
Other risk factors include diabetes, smoking, and prolonged exposure to sunlight.
Is it a major process? You can tell me to get this fixed or resolved to the best possible.
Cataract surgery, as Ms. Brewer will tell you, is one of the most common and successful surgeries performed in America. It takes about 15 minutes. You go home the same day and your vision starts clearing up over the next couple days. Majority, if not almost all patients have improved vision after cataract surgery. And now with new advances in cataract surgery, such as laser-assisted cataract surgery, it creates a much more safer, precise, and accurate outcomes.
Now, I'm sorry, did you say you went to the eye doctor and they noticed it? Were you planning to go because of the problems you were having, or you were just there for a checkup?
I went for my annual checkup.
Okay.
And then when I was looking through whatever those things are that you look through to check your eyes, I thought, my goodness, I can't see those letters that I used to be able to see. And she told me, she said, your vision has really failed. You've got cataracts. I said, you've got to be kidding me.
Mm-hmm.
They were fine last year, but it happened that fast.
And as far as problems with the eyes, is this one of the more faster moving disorders that are out there?
I wouldn't say it's one of the more faster moving. It's one of the most common. As you had commented earlier, it's one of the most common causes of preventable blindness in the world.
Mm-hmm.
So that's the importance of getting your eyes examined on a regular basis and going to the eye doctor at least once a year, especially after the age of 60, to find these things and to take care of them and get them seen.
Really? I did not know all of this. Thank you, Dr. Patel. Mary Jane, thank you for coming.
Oh, you're so welcome. It was a pleasure being here.
Very enlightening for me. Well, you can get more details about cataracts and the risks they pose to your health at news4jax.com. We've just posted a link to a fact sheet from the National Institute of Health, and you'll find all that on the Morning Show page in the links section.